You open your email and there are tens of emails regarding coronavirus, whether it's a new policy or a new procedure to follow in your work. You open your phone and there are messages regarding coronavirus, people worried or sending you precautions to do for yourself and your family. You browse social media and there are tons of news about number of deaths or number of infected people or which celebrity got infected or how to protect yourself and your family. You open your TV and news overwhelm you with how bad the situation is or going to be. Everywhere you look, there are bad news or even just news about coronavirus. And either way, this is affecting your mental health badly, especially if what you're surrounded with is negative messages about how bad it is, or number of deaths, or infected people, or how quarantine is affecting you and your family. Even if you're surrounded with funny comics about what is going on, it is still taking so much of your mental focus, which leads to the conclusion that this is something more important than others to focus on. And I can't help but notice the anxiety levels going up for the majority of people. I want to say some, but from my observation to the people around me in my family, work, and the community I'm living in, it's the majority. So, today I would like to manage your mental health during this coronavirus outbreak and how to lower the anxiety levels if you're suffering from that. And instead of sharing with you the information you probably already know, I'm going to do it differently. I'm going to make you identify what's exactly causing you to be stressed, because I'm willing to bet it's different from someone else. And then how can you handle it properly for your specific case? So, yes, this is a coaching session where I get to ask questions and you reflect on them. And afterwards, I'm going to walk you through these questions and what they represent. If you're new here, this is WellBeing Toolkit, where I provide you with all the tools you need to improve your well-being so that you can integrate and upgrade your life. I do tools tutorials mainly, plus aware me videos about important health topics, mentor me videos, guide me videos about key books to learn and apply, and coach me videos like this one. So, if I got your attention, if you are interested in having all the tools you need from one place, consider subscribing. So, as I always recommend, engage with the questions either by writing down the questions and the answer to reflect on them a couple of times later, or simply answer the questions out loud. Also, remember that this is a one way conversation. And if we're doing this together, the questions or their order may change according to your answers. So, play along with these questions for now. And if you still want us to talk, I'm one email away. Ready? Let's go. On a scale from 0 to 5, how much anxious are you with this coronavirus outbreak situation? 0 being not very much, 5 being very much. What do you think in your case is contributing to this number? I'm going to give you examples. Is it media, number of deaths, a death in the family, lost work, etc.? What is or are the sources that increase your anxiety levels? Again, a couple of examples here. Is it TV, news, social media, others? What messages are you telling yourself about the coronavirus outbreak situation? And what else? How can you improve those messages? What can you do less of for yourself to feel better? What can you do less of for your kids to feel better? What about your spouse, your parents? What can you do more of for yourself to feel better? What can you do more of for your kids to feel better? Now, your spouse, your parents. Name 3 positive things that have changed in your life because of the coronavirus outbreak. Who you would like to have for support. Couple of examples here: a family member, a friend, a colleague, anyone. What would you like that person to do to support you? What is preventing you from reaching out to him or her? What can you do to overcome this? When can you reach out for that person? How would you do that? Is it an email, a phone call, or what? Great work. Now let's do the interpretation of these questions to know what they are for. The first one, this is to measure your level to track later, like a week from now. Always remember, you can't improve what you can't measure. So if you're 2 now and next week you're 3, then you're doing the right things. If it is the other way around, then something is wrong and you need to revisit the following questions. The next questions are for identifying the external and internal sources of that anxiety. Knowing is 90% of the solution, right? So keep working on these. If we knew what is increasing our anxiety and stress levels, we can always eliminate them or use less of them or modify, etc. The next question about how to improve the messages. This is one of the ways to manage the internal sources of the anxiety and stress, either by negating them, like replacing the word sad with not sad, or more preferred to alter them, like replacing not sad with using the word happy, because this is how your brain works, interpreting each word you say even if negated. If you don't believe this neurolinguistic programming fact, then look at Google. If you're searching for not sad, the dominant results will be related to sadness, since it's one of the keywords you type to search for. If you want happy results, then you have to search for happiness instead. For the other questions of what can you do less of and what can you do more of for you and your family, those are for identifying things or actions you can do for yourself or your kids or spouse or parents or others, either by doing less of or more of to feel better. This is a strong list since it's created by you, and you'll notice that you can have different actions for yourself than for your kids or your parents. Also, you can have as many lists as you need, like for your brothers and sisters if you're responsible for them, or your employees or friends, and so on. The other question about name 3 positive things. This is an obvious one. 3 things to be grateful for. If you really looked, you may come up with positive things that happen now and wasn't available before, like how you're spending more time with your family, or you saved your commute time, which was killing your day and back if you're like me, and so on. Keep reflecting on this question, you'll be surprised. The final questions about who would you like for support, what would you like them to do for you, when can you reach them, how, and so on. This is you finding an external support from your life circle that can look out for you if you need. Answering these questions is basically making the plan, which includes what you want them to do for you, what is preventing you from reaching out, what to do to overcome this, and finally, when and how to reach them. Now that everything is planned, you just have to act. I hope you benefited from this video, and I'm reminding you that I'm one email away if you still need support. Just send me an email at toolkittoimpact@gmail.com and I'll get back to you. Did you like this video? If so, you can share it with others who you think will benefit from as well. Always happy to have you subscribe and join the WellBeing Toolkit community if you think it's adding value. Till next time, apply, achieve, integrate, and upgrade your life.